um, a set of saline implants from the year 2000. This is when the silicone implants were not allowed. She comes to me with almost all the symptoms except for like a few. Otherwise, she has all the subset symptoms of breast implant illness. And we'll hear from her as well. She wants to share her journey. And what I want to do here is 100% total capsulectomy, 215, initials KM. I cut out the excess tissue here plus the scar. This helps with the contouring. And as you will see, she's got the saline implant, relatively reasonable sized capsule. And as I go in, you will see uh, minimal blood loss. I was very happy, very pleased with how the surgery went. And these were supposed to be the safer, better implants. Now, as I go in the back, this is the take-home message. If I go in, if you look, there is some fluid around in the back, right? You see some. So I'm actually going to grab this, and I go like this. Look at this. Just like you've seen me do this with the ruptured silicone. This is that slime type consistency. This is the silicone bleed, the gel bleed, if you will, the silicone bleed from the silicone shell of the saline implant. This is your Magan 300, just like the patient said. That is slowly leaching into the body and causing the disruptive signs, symptoms of breast implant illness. Also, by looking at it, it's a little bit overfilled implant, intact implant, and we can tell saline implants are intact. And you saw that stickiness. And if you look at the capsular tissue, some areas are thin, some areas thick, and complete removal of the entire implant capsule has been done. As you will see, you can see my uh, gloves, how thin this tissue is. And overall, all of this tissue, inflamed tissue, has been removed. And remember, this tissue, if you will, around, this is that capsule, but the fatty tissue around harbors in it all this badness as well. So that has also come off because that leaching has embedded within it. Now, this is what I did with Dr. Henry Dykman 3 years ago or so. I told him to take the saline out, centrifuge it, and he did centrifuge it at 11,000 RPM for 1 hour. And then he looked under electron microscopy only to find what were those silicon spheres, if you will, that were going into the saline, consistent with if it's going into the body, it's certainly going inside, and we have that quote, very direct proof. Now, as you will see right here, this is the tissue, the excess tissue that are removed. And if I go in, you will see the same issue with what are supposed to be the safer, better saline, but the same set of problems. You cannot look at someone's saline nature of the implant and say that's better, safer. The patients present with the same set of problems, and as you will see, look at the fluid around. And as I go in from the back and from the front, you will see there is some fluid around. So if I'm going to go ahead and grab this with my, you can see the shininess, and I go in, see this, it's a lot more here. But see, this is slowly leaching into the body and certainly going inside. And if there's any biochemists, mass spectroscopers, or research docs who are interested, we can always analyze the saline again so that we can show, we have shown it once, but more research needs to be done. So this is that Magan 300 as well, saline implant. And as you can see, it's not as filled as opposed to this one. This is more filled. And a capsular tissue that, as you will see, there are some bands. Actually, if you look at these crystallizations that are occurring, calcium, this area is a little bit thicker. Look how thin this is. You can see my glove. And no matter how thin the capsule is, look, you can see 887, the numbers, you can read them. No matter how thin the capsule, it must be all removed and all that tissue around. So if you look at this yellow fat behind and these bands are white, all of this tissue has been removed such that because it is abnormal, it feels abnormal, and everything is essentially contained. So this is the implants will be returned to the patient, which always returned. Number two, the capsules are sent to pathology, rule out the BIA, which is the breast implant associated anaplastic large cell lymphoma, rule out malignancy, CD30 analysis to rule out squamous cell cancer, breast cancer, whatever it may be. And then the cultures are done for bacteria and fungus. The blood loss is being minimal for the patient, 5 cc's on the right and left. This has been consistently the case well over 99.7% of the patients, no need for drains. And most importantly, we'll hear from the patient her own words. She came all the way from Oregon. We'll hear from her in regards to her detrimental effects of breast implant illness. I did actually get a video testimony from her. She wanted to share her journey. So we'll follow along with her and see how she has recovered from what are these supposedly safer implants. They cause the same detrimental effect as silicone implants intact and the same as ruptured silicone implants. And eventually, as you will see, the patient had a phase where she was okay with them, but then eventually the symptoms did catch up with her, and she was only convinced that this is what is breast implant illness because she's gone through a whole series of doctor analysis, labs, among workup, which showed workup after workup that everything was benign. So there you have it. This is Dr. Khan, Executive Plastic Surgery.